Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. So, in the today's very important session, we are going to discuss the very important clinical conditions, questions, concept for our upcoming Norcet exam. So, here my point is very clear to give the very important and high yield and the golden points content to every one of you. And I want everybody's active participation in the class. So be very attentive, active in the class. So listen carefully, and wherever I am explaining the golden points, okay, take a note of that one very quickly. Okay, so definitely you people will love the content, and you people will definitely love the class of the today's class, because the content what I brought in front of you is the content for your selection. Yes, so fatafat do like to the session. Yes, everybody who all are live to the session, so fatafat do hit the like button. So we will continue the today's session. A very good evening to one and all who all are attended the today's class. So I want everybody's a very active participation for the today's class, because it is the a very important class for you all, right? Fatafat. Everybody do hit the like button. So we will start the today's session with this powerful motivational quote. A very good evening. Once again, welcome everyone to the Master Nursing classes, where the after learning the students becomes masters here. Okay. So yes, welcome once again everyone. For fatafat do hit the like button. We will start the today's session. Students, you have to understand the basic thing that the successful peoples are not God-gifted peoples. The successful peoples are not a gifted peoples. They are also hard workers. They are also strugglers. So who all are the today's experts are there? They are also once a beginners. So they have started to learn. They have started to understand. They are craving for the knowledge. So today they are the successful peoples. So always remember, yes, if you are intelligent but not hardworking, definitely your result will not come. Even if you are not intelligent but you are a hard worker, yes, you can beat the intelligent people very easily. So here the word hard work is very important, and you have to believe in this one. You have to believe in this particular process. You have to believe in this yourself. So then only the result will come, and then only the result will be yours. Yes, the successful people are not God gifted, so they are also hard workers like you people. Okay, so yes, once upon a time, you are also a beginner. Now you have learned a lot of the thing, right? So you are scoring good in the test series. Okay, you are scoring good in the mock test. Why? Because you have learned. Okay, you have worked hard. So that is the reason. So you have to believe in this yourself. Okay, so everything is possible. Very good evening to everyone. Once again, welcome everyone to the Master Nursing classes. So today's class is very special class. So don't leave the class in middle. Okay, completely watch the class till the end. And very importantly, I will hold one question and all the possible surround of the 10 to 20 golden points. In particular, one question I will teach to every question, so it will be very much helpful to everyone. And if any question is coming from this particular concept, definitely the Nagaraj sir question only it will come in your exam, because all the golden points with a very easy and understanding manner I have presented in front of you all. So yes, fatafat take a note of the particular golden point while explaining. Okay, so don't neglect anything, because it is important thing, right? So in this particular short time, I am giving a very huge and very important and very valid content. Yes, so fatafat do like the session, and we will start the session here. Okay, let's begin the real game. So the game is here on now. The first question is coming in front of you all like this. So fatafat do read the question and give the best answer in the comment box. Which of the following is the classical clinical sign of the epiglottitis in the children? Yes, which of the following is the classical clinical sign of the epiglottitis in the children? Fatafat. Option A is the barking sign. Option B is the drooling and the tripod position. Option C is the runny nose and the sneezing. And option D is the productive cough. So which one is the correct answer? I want everybody's correct answer in the comment box, because in the old sessions we have already discussed the Croup, epiglottitis, right? Yes, option A is the barking cough, option B is the drooling and tripod position, option C is the runny nose and sneezing, and option D is the productive cough. Very good. Well done, but almost all the students have been given the correct answer. That is the drooling and the tripod position goes to the correct answer for the epiglottitis. Okay, so beta epiglottitis is a medical emergency. I will ask Why, sir? Why it is the medical emergency? Sir, it is the medical emergency. Why you are telling this one is the medical emergency, sir? Sir, epiglottitis means it is on the infection and the inflammation of the epiglottis. And epiglottis is the very important organ made by the elastic cartilage. Okay, it is having the function to close the airway and to open the airway. Okay, while inhaling the air it will opens the airway, while exhaling at the end of the exhalation it will close the airway. And whenever we will swallow water, whenever we will swallow food, that time it will close the airway in order to prevent the aspiration of the food content, right? So it is the cap. Okay, it is the like a lid on the airway. Okay, so that is the reason whenever there is in the airway and the lid of the airway, whenever there is an inflammation of the lid of the airway happens, that time there is the chance of the blockage of the airway is there. Okay, so that is the reason epiglottitis is in the medical emergency. Okay, it is in the medical emergency. Why? Because it will blocks the airway. Okay, so if someone is asking a question, so what is the priority in the management of the epiglottitis? In the priority in the management of the epiglottitis is the airway management. Okay, so that one is the airway management is the priority. So how to manage, what to do, what not to do, okay, everything I will explain here because it is important for your exams. Okay, so yes, where we will see the barking cough, we will discuss this particular barking cough also. Okay, so where we will see, just for your golden point revision, yes, very nice of you all. Okay, in the crop we will see the barking cough. Okay, so yes, so let's come to the golden point revision on the epiglottitis. Okay, so I hope the basic of the epiglottitis is very clear to every one of you. That is the infection, inflammation of the epiglottitis. It is a medical emergency. Why it is medical emergency? Because it will blocks the airway, and the priority management here is to management of the airway and keep the airway open, patent. Okay, that is our primary goal here. Okay, so let's come to the golden point revision. Sir, which one is the most common cause, sir? So you have to focus two things in the while attending the questions on the most common cause here, sir. Yes, most common cause. If the question in the question they have mentioned most common cause in the unvaccinated child. Okay, so child have been not get vaccinated. So in the unvaccinated child, the most common cause is the Haemophilus influenza B. Okay, and due to the hib vaccination. Okay, so in the pentavalent vaccine, you know, in the pentavalent vaccine, what are the 5 components are there in the pentavalent vaccine? Penta means 5. Okay, so here we will have D, P, T, Haemophilus influenza B, and hepatitis B. Okay, so DPT, hib, hub. Okay, so in this particular pentavalent vaccine, we have this particular hib here. Okay, so this due to the national immunization schedule and due to the routine vaccination, so the vaccinated child will not get the infection with the Haemophilus influenza B, and in the unvaccinated child only there is in the most common cause is the Haemophilus influenza B. Okay, sir, what I told while answering the question of the most common cause of the epiglottitis, look in the question. If they have mentioned the unvaccinated child, your answer should be Haemophilus influenza type B is the most common cause for the epiglottitis in the unvaccinated child. And nowadays, the incidence of the Haemophilus influenza B is reduced because of the National Immunization Program routine vaccination of the pentavalent vaccine. Okay, so do remember this one. Okay, it is important, right? In the vaccinated child, so which one is the most common, sir? Already the child have been taken the vaccination, means there is no any chance of the incidence of the Haemophilus influenza type B. So in the vaccinated child, the most common cause is the first priority goes to the Staphylococcus pyogenes. Then the second one priority goes to the Streptococcus pneumonia. Sir, why, sir? Because the Streptococcal pyogen is the broad classification and the Streptococcus pneumonia is the part of that one. So you please understand the concept and choose the first answer as a priority answer in the question. If the both options have given, means so first priority goes to the Streptococcus pyogen. Okay, so the second priority goes to the Streptococcus pneumonia. Yes, in your coaching centers, I don't know what they have studied. Okay, this is the actual standard concept you have to understand. Okay, so if the Streptococcus pyogen is not there in the option, the single best answer is the Streptococcus pneumonia. Okay, so if it is not there in the option, if it is there in the option and the both are there in the option, choose the Streptococcal pyogen as the correct answer. Okay, hope it is clear. Yes, most common cause unvaccinated child hib, in vaccinated child Streptococcus pyogen, first answer. If it is not there in the option, Streptococcus pneumonia. Hope it is clear to every one of you. Yes, so very important. Sir, they have not mentioned the unvaccinated and vaccinated. Which one we have to choose? Yes, choose the bacterial one. This one is in the correct answer. Okay, Streptococcus pyogenes. Okay, I hope it is clear to every one of you. Yes. So next come to the classical clinical signs of the epiglottitis. Better here we will see the 5D sign. Okay, here we will see the 5D sign. Very very important. Keep in your mind. So why sir? Why this 5D? The dysphagia, why it is happening? Drooling, why it is happening? Okay. So the dysphonia, why it is happening? Okay, and the distress, why it is happening, and the dyspnea, why it is happening. So why because the epiglottitis is a infection of the epiglottis and it is closing the airway. Okay, so while the airway is closing means where there is in the difficulty in the swallowing also there. Why? Because at the area of the swallowing there will be a inflamed structure in there. So that is the reason here there is a patient is having the difficulty in the swallowing. Okay, so in the patient with epiglottis we have to keep the patient nil per oral. Remember, we have to keep the patient nil per oral until the proper airway is established. Very very important point, keep in your mind, right? So then the patient is having the continuous drooling. Why the continuous drooling? Why the saliva will continuously come out? Why? Because so saliva is not going inside because there is the epiglottitis which is blocking the swallowing of the saliva. Okay, so it is not going inside and it is continuously coming outside. The drooling will happens in the epiglottitis. Sir, why dyspnea will happens? So dysphonia will happens. Okay, so everybody know, you know. So that is the where the voice will generate. Voice will generate in the voice box. So voice box is our, yes, larynx is also called as the voice box. Okay, so that larynx is below the epiglottis. Okay, so you know the larynx is below the epiglottis and the air will comes through that particular part, means then only the the sound will be created. Here it is the epiglottis which blocking, means the sound will come but it is on the muffled sound which will come. So, okay, the hard potato voice. Okay, the classical clinical picture. Okay, remember the hard potato voice will be seen in case of the epiglottitis. Okay, so the dysphonia, that is the muffled or the altered voice will be seen in the epiglottitis. Okay, then the distress, the respiratory distress or the difficulty in the breathing, or we can say the dyspnea also. Okay, so we can, some book mentioned as the 4D and some book mentioned as the 5D. So just remember this D's because these are the very very important for your exam, right? So hope it is clear to every one of you. And I told here, okay, so the airway is compromised because of the epiglottis is blocking the airway. Okay, so in order to open the airway, the child will assume the tripod position in the epiglottis. Okay, so yes, child will automatically, it will sit in this particular position. Okay, how it will sit? It will keep the hand in on the knee or on the floor and it will lean forward like this and it will push the chin forward. Okay, in order to open the airway. Okay, so very very important. Remember, so which position the child will assume automatically? Okay, child will sit automatically to decrease airway resistance, or we can say to open airway. Okay, so which position the child is assuming? The child is assuming this particular position. We call this one as in the tripod position. Remember, the tripod position will be seen in which case? It will be seen in case of the epiglottitis. Okay, so already asked the question many times and it is the very important thing. Okay, so try to remember, right? Sir, the child is assuming the tripod position, then the airway is opening, means that is the very important thing we have remembered. Sir, in which position the airway will get blocked? Sir, whenever the patient will or the child will sleep in the supine position, that time the airway will block, sir. Why? Because in the supine position, the epiglottis, like the supine position, the epiglottis will close the airway. Okay, so that is the reason. The stridor means a respiratory sound which happens due to the obstruction of the upper airway. Okay, so that is what you call the stridor. What is the stridor? Stridor is then the respiratory sound which happens due to the partial blockage of the upper airway. That is what we call the stridor. Okay, so with this particular stridor in the epiglottis, it will increases with supine position. Okay, it will increases with supine position, right? So that is the reason never ever give the supine position to a child with epiglottitis. Remember, the upper airway obstruction which is increasing due to the supine position, and child will assume the tripod position in order to open the airway. Okay, so and the 5D signs are the very important signs of the epiglottitis. Okay, so then comes to the next very important like seen, I have already told that the muffled voice or the hard potato like voice will be classical seen in the epiglottitis, and the thumbprint sign or the thumb sign on the x-ray. Okay, so that is in the lateral way of the x-ray. Okay, so this portion of the x-ray. Okay, so lateral x-ray of the neck we have taken, and here are you able to see the thumb like structure? Are you able to see? I'm like zooming the video. Or okay, so look at this particular thumb. Okay, so this one, this is what we call as the thumbprint sign. Okay, so in the lateral neck x-ray we are getting the thumbprint sign, means where we will get that one. So it will be get in case of the again epiglottitis. Okay, so where we will get this one? We will get this one in the epiglottitis. Yes, very important. And also child will be having the high grade fever. So in order to treat this one, we will give the acetaminophen or the paracetamol. Okay, and the child will having the cherry red color. Okay, so not reddy, it is in the cherry red color edematous epiglottis. Okay, so this is the very important point. What is the color of the epiglottis in the epiglottitis? That is the a cherry red color epiglottis we will see in case of the epiglottitis. And there is in the absent of the spontaneous cup. Okay, so why? Because the epiglottis or the airway should be open to initiate the spontaneous cup. Okay, so due to the epiglottitis the airway is blocked. Okay, the cap of the airway is closed, so there will be absent of the spontaneous cup will be there, and due to the blockage of the airway there will be a chest wall retraction will be there, and due to that one there will be a tachycardia and tachypnea also will happen. Okay, so very important, remember the golden points. Okay, so what all are the things I have explained till here? The most common cause in the unvaccinated is the Haemophilus influenza B, and now due to the vaccination, the incidence of the Haemophilus influenza type B is decreased. Okay, so the now most common cause is the our Streptococcus pyogenes or the Streptococcus pneumonia. Okay, so like due to the and like I told immunization schedule. Okay, so there will be a less incidence of the Haemophilus influenza type B because in the pentavalent vaccine we are giving the Haemophilus influenza type B vaccine. Okay, so in the already vaccinated child, the incidence of the Haemophilus influenza type B is low. So in the vaccinated child, the most common cause is the Streptococcus pyogenes, and the second most common cause is Streptococcus pneumonia as a priority answer I told. Okay, so after that we have discussed the PID sign. After that we have discussed the tripod position. After that I have told the scenario that is the supine position increases the obstruction of the airway. Don't give the supine position. And the classical voice, hot potato voice, the thumbnail sign in the lateral view of the X-ray, and the cherry red color edematous epiglottitis, and the absent of the spontaneous cup, chest wall retraction, tachycardia and tachypnea. These are the classical signs we have to see in the patient with the epiglottitis. Sir, how we have to manage this epiglottitis, sir? Yes, so I used to tell some golden points here. Okay, so better, so remember the priority in the management of the epiglottitis is that is our very important. I already told that is the airway management, because this is under a medical emergency which is blocking the airway. So here the opening the airway is the priority. Okay, so what are the things we have to do to maintain the airway patent here? Okay, so never ever check the oral temperature in the case of the epiglottitis. Okay, so if you are checking the oral temperature, there may be a stimulation to the epiglottitis, and which may leads to the bronchospasm, which may leads to the complete airway obstruction. So never ever check the oral temperature in the epiglottitis case. Never ever try to visualize or try to examine the posterior pharynx. Okay, so don't try to open the mouth completely and visualize the throat and posterior pharynx by using the tongue depressor. Okay, so why? Because it will stimulate the inflammation part and it will causes the complete blockage of the airway. Okay, so do not attempt to examine the throat. Okay, so very important, try to keep in your mind. Okay, avoid using the tongue depressor or any instrument which inspect the mouth or throat. Okay, so don't insert anything till the posterior pharynx, the golden word. Okay, don't check the oral temperature, very important, and allow the child or the patient to sit in the tripod position and never ever give the supine position. Why? Because I told the supine position again it will cause the backward falling of the epiglottitis and it blocks the airway. Okay, so don't give supine position, allow the patient to sit in the tripod position, very important. Okay, so keep the patient cool and calm. Okay, so don't do any painful procedures until the airway will be secured and until the airway will be opened. Like, so whenever a child comes to us with a high grade fever, what we will do in the inpatient department in the pediatric ward, what we will do? Yes, whenever the child will come as the admission, first thing we will prepare for the IV cannulation. But in a case of the epiglottitis, until the airway is completely secured, never ever do any painful activities. Okay, why? Because if we are doing the IV cannulation means that time the child will cry. So the child is crying means, so there is chance of again the airway blockage is there. Okay, so keep the patient cool, calm, relaxed. Very, very important. Keep in your mind. Okay. So don't do any painful procedures until the airway will be secured. Like IV cannulation should not be done until the airway will be secured. Okay. So then the prepare for the emergency airway management. Whenever the child with epiglottitis will come to us, so always keep the intubation and the tracheostomy ready. Okay, so after the blocking of the airway, we are going and searching for the tracheostomy set and the airway set and intubation tray. So till that the child may get land into a irreversible condition. So don't lose any child because of a simple infection. Okay, so that is the reason whenever the child will admit to your ward with a epiglottitis, always keep the intubation and the tracheostomy equipment ready. Okay, so why? Because it is on the medical emergency. We don't know when the situation will arise just to get a intubation to done. Okay, so that is the reason tracheostomy intubation set we should keep ready at the bedside in the case of the epiglottitis. Okay, so next comes to how we have to administer the oxygen. Okay, so here we are not only administering the oxygen, along with the oxygen we are giving the helium also. Sir, why we are giving the heliox here? Okay, so this both oxygen plus helium together, we call this one as the heliox. Okay, so this heliox, why we are giving here? Why? Because it is reduces the turbulence, means the inflammation it will reduce. Along with that, if the inflammation is reducing, means airway obstruction also it is decreasing. Okay, why? Because this heliox will reduces the turbulence of the airway and it will decreases the airway obstruction also. Okay, so I told there will be a difficulty in the swallowing. Okay, if you are trying forcefully, you are like feeding the child and the feeding like child is trying to swallow, means that time the airway will get painful and there is again the strenuous activities. Okay, so again there is a chance of the blockage of the airway. That is the reason always keep the child nil per oral in the epiglottitis. Okay, so then provide the cool, mist and highly humidified oxygen therapy. Okay, so this was your last exam question. This was your last exam question. Do remember the very, very important point. Okay, so we have to give a very cool, mist and highly humidified oxygen therapy. Why? Because it is cool, means it is making the airway also very much cool. The airway is very much cool, means that time the vasoconstriction will happens to the airway. Okay, so like in the airway vasoconstriction is happening, means there is less blood supply will happens and the edema of the airway will reduce and the swelling of the airway will reduce. So airway will get open here. So that is the reason always try to give the cool, mist and highly humidified oxygen therapy in a case of the epiglottitis in order to reduce the swelling of the airway. Okay, so if the child is unvaccinated, provide the Hib vaccine. So we are giving the pentavalent vaccine. Okay, so we have to give the pentavalent vaccine. Remember. Okay, so if the child is diagnosed with the Streptococcus pneumoniae or the Streptococcus pyogenes or the Haemophilus influenza type B, okay, in this particular situation, in order to treat the infection and in order to treat the cause, so we will give the IV antibiotic and along with that we will give the painkillers and the antipyretics to decrease the high grade fever. Okay, so these are the golden point chanting what I have done in the epiglottitis. Yes, within a 10 to 15 minutes the one disease condition is completely covered. Okay, so now the point of discussion will goes to the next question. So that is in front of every one of you. So please do read the question carefully, completely. Try to give the best answer in the comment box. I'm waiting for your answers in the comment box. So fast, be active. Okay, be active, beta. Yes, do read the question carefully. Take your own time and give the best shot. Okay, don't land into a hurry here. Okay, read it, understand it, and analyze it and give the answer. Okay, so there is no any gadbad here. Okay, energy ko barkar rakho. That's it. You have to be very energetic in the class. Otherwise, I will land into depression. Okay, don't let me land into the depression. Yes, very nice of you all. Okay, so what happened here? Here there is a 2-year-old child is brought to the emergency department by their parents. Okay, at the night. And what happened here? The child is having the barking cough and there is a hoarseness is there in the voice. And the child is having the inspiratory stridor. Okay, whenever the child will try to inspire the air, that time the sound is coming because of the upper airway obstruction, which happens here. The sound will come in the upper airway obstruction in the stridor. Okay, so then his parents is saying that he was fine earlier in the day, but symptoms are worsened rapidly at the bedtime. And he has the low grade fever also, and he is completely alert and what is the most likely diagnosis here, right? Better. So we have the 4 to 5 clue to choose the one answer. So that is the reason multiple time, repeated time I used to tell to you people, don't hate the big questions, because big questions will give the a lots of the opportunity to you to choose the correct answer, and it will give the lots of the clues, okay, to give the correct answer. Better, you know, the Croup will be, incidence will be very high at the age of the 2 years, okay. So it will happens to be usually for 6 months to 5 year, and the incidence is peak at the 2 year. The first clue is here, the 2-year-old boy, okay. So they have brought to the emergency department at the night time, and the symptoms will worsen in the night. So this will be a very important classical picture you have to remember, okay. So the 2-year-old boy, they have brought to the emergency department at the night. Again, one more clue, okay. And the classical picture also they have mentioned here, the child is having the barking cough. Then what you want to answer? Yes, the barking cough is there, and there will be harshness is there. Along with that, there will be inspirator stridor is there, okay. And his parents are saying that he was completely fine earlier, and now he's having the sudden onset of the problem in the bedtime, okay. So the problems are worsened again at the bedtime. Again means the child is having the increased symptoms in the night time, okay. So he is having the low grade fever also. So what is the correct answer here, okay? Option A, epiglottitis. Option B, Croup. Option C, the bronchiolitis, and option D is the asthma. So what is answer is correct here? Yes, which answer is correct here? Yes, very good of you. So almost all 99% of the students have given the correct answer. So that is the Croup, okay. So what is the Croup? Croup is the infection, inflammation of the three things. That is the larynx, trachea, bronchi, okay. So there is the infection, inflammation of the LTB, that is the laryngotracheobronchitis also we will call for the Croup, okay. So these all are the upper respiratory and the lower respiratory middle infection there, and almost all obstruction will be there in the upper respiratory tract, okay. So in this particular situation, what happens here, okay, the child is having the inspirator stridor, harshness, and the barking cough will be there, okay. So the barking cough is the classical picture of the our Croup disease, okay. So remember, let's discuss the golden point here, okay. So that is the Croup. We also call this one as in the laryngotracheobronchitis, okay. So you can remember as a LTB. Otherwise, you will in the while answering the questions in the exam, you will get whether it is in the laryngotracheitis or it is in the laryngotracheobronchitis, you will get land into the confusion. So that is the reason I have written this one as in the, you can remember it is the lungs and it is the tuberculosis of the lungs, okay. That is the lung TB also you can remember, or LTB, that is the laryngotracheobronchitis, okay, for the understanding and remembering purpose, okay, in the exams, right? So in the Croup, the most common cause is the viral cause, okay. So the most common cause of the Croup is the viral cause. And which virus is the most common cause to organism for the Croup? The para-influenza type 1 is the most common virus which will causes the Croup, okay. So other viruses also like respiratory syncytial virus, influenza virus A and B, and the adenovirus also will causes the Croup. But the most common is the a very important para-influenza virus number type 1, okay. So which will affect the children's, I told, at the age group of the 6 months to 5 years, and the peak will be there in the 2 years, okay. So peak will be there in the 2 years. The classical features of the Croups are like this: the sealed like barking cough will be there, and the inspirator stridor will be there, and harshness of the voice will be there, and the low grade fever will be there, okay. So search in the question, all the clues are given, okay, in the question. Look at this one. Yes, I told the Croup will be peak at the year of the 2 years. Yes, sir, it is there. And I told the symptoms will worsen at the night. Yes, sir, the clue is there. The classical picture, barking cough is there, sir. The harshness of voice is there, sir. And along with that, inspirator stridor is there, sir. Yes, all the symptoms they have given, okay. And the low grade fever is there, sir, okay. So these many clues they have given in the question to choose the one correct answer, okay. So always love to answer the big questions, because big questions gives the lots of the clues to choose the correct answer, okay. So yes, according to the criteria, everything is matched here. So the question, it is a case of the Croup, okay. So in the Croup, we will see one classical sign in the X-ray. That sign we call as in the stipple sign, okay. So stipple means it is in the we can say it is in the upper portion of the church, okay. Here where we can see like this, right? So like this we will get in the airway, okay. So here this is the main airway. Okay, so here will be the narrowing of the subglottic airway portion. Okay, so below the glottis the airway portion is narrowed here, so that is what we call the subglottic narrowing, or we can say this one is the stipple sign at the anterior posterior view of the neck. Okay, so this will be a very important one. Already this question I have discussed in the X-ray interpretation. Okay, so there is a special class I have uploaded in the YouTube on the how to interpret the X-ray. And why? Because in the last year mains exam you got the match the following question on the X-ray. Okay, so that was the question related to the how it will get in the pneumothorax and how it will get in the cardiomegaly. So these type of the questions they have asked in the last Norcet. So there is a special dedicated video is there on the X-ray. If you want, you can see that it is already uploaded in the our app also, and it is also available in the YouTube also. Okay, so remember hypoxia is not an early sign of the Croup. Okay, so hypoxia is the late sign of the Croup. Why? Because many times they have asked the earliest sign, and in every question there is in the hypoxia is the option. Okay, so do remember that hypoxia is not an early sign of the Croup, it is in the late sign. Okay, it will be considered as the late sign of the Croup. Okay, so very important, right? So here how we have to treat the Croup. Okay, so if the Croup is in the mild stage or it is in the stage 1, so we have to give the oral steroid, that is the dexamethasone single dose we will give here. Okay, along with that we will administer the if admission is required or not, we will check here. Okay, usually in the mild stage or in the stage 1 there is no any admission required. Okay, it will resolve automatically in the next 3 to 5 days. Okay, it will resolve automatically in the next 3 to 5 days. Okay, that is the reason in the mild or in the stage 1 of the Croup there is no admission is required. And advise how to use the cool vaporized air. Okay, so at the home. Why? Because this mild case we are giving the oral steroid single dose. Okay, and we are sending this particular child back to the home, and we have to advise them how to use the cool vaporized air. So why again cool vaporized air? So this will reduces the airway obstruction and it will reduce the airway swelling. Okay, so that is the reason we have to advise in the case of the Croup also, like in the epiglottitis also we have given the cool vaporized air. Okay, so that is the highly humidified air. And again in the same the Croup also, again next we will discuss one more condition. So there also we will give the cool vaporized air we have to give to the child. It is compulsory. Okay, so what are the instructions we have to give to the parents of the child? Means yes, the instructions we have to give, that is the encourage for the cool air at the night. Why? Because the Croup symptoms will increase at the night. So if the child is having the cool air at night, means the airway it will not get blocked. If the airway is not getting blocked, means the child will get recovers slowly progressively within 3 to 5 days of the next 3 to 5 days the child will get recover. Okay, so remember. Okay, so how to take the cool air? Sir, from the open pressure the child can take the cool air. Okay, so no problem, from the open pressure he can take the cool air. And if not possible, take the child to a cool basement. Okay, wherever there is in the like garage will be there is a basement will be there in the buildings. Okay, so there the air will come very cool. Okay, so wherever there is in the very cool air will come, so take the child to that particular location and make him to inhale the cool air. Okay, so that is the very important for the Croup. Cool air is important in the Croup, remember, right? So the next is here the moderate to severe cases or the stage 2 or 3. Okay, in this particular situation we have to admit the patient, and this particular point is your exam question. Okay, so in the stage 2 or in the stage 3, okay, or in case of the moderate to severe case of the Croup, we have to give the epinephrine nebulization. Okay, so this will be a very important question, very important point for your upcoming exam. Do remember. Okay, so in the Croup what we are giving, in the moderate to severe cases of the Croup we are giving the epinephrine nebulization. Along with this we will give the dexamethasone, okay, and oxygen, that is the highly humidified oxygen plus dexamethasone plus epinephrine nebulization we will give in the moderate to severe case of the Croup. Okay, so along with that, if the very severe cases comes, means if the airway will be completely blocked, that time we will go for the intubation. Okay, so hope everybody got understood the very important questions and concept on the Croup. Okay, so hope it is clear. Whether need to repeat again? Yes, whether need to repeat again? Just will repeat the golden point. Okay, so I will write the question, you people write the answer here. Okay, what is the most common cause of Croup? Is your question. So fatapat do mention your answer. What is the most common cause of the Croup? Yes. Second question, barking cough is classical picture of dash disease. Yes, what do mention? And in the X-ray, we are getting the stipple sign. Stipple sign in antero-posterior view of X-ray. So where we will get this one? Yes, stipple sign in the antero-posterior view of the X-ray. In which situation we will get this one? So what do mention? Yes, the most common cause of the cough. Very good, very nice, beta. Very good. Then the barking cough. Very nice. Stipple sign. Do mention the stipple sign. Where we will get that one? Well done, beta. Well done. Okay. So here will be our next question. Yes. So do answer the question, and we will go to the next disease, okay, as soon as possible. So whatever the content I am giving here, it is the golden content. Don't forget this one, beta, because it is the very important for you all, right? Yes. What is a common causative organism of the bronchiolitis in the infants? Common causative organism of the bronchiolitis in the infants. Option A, Haemophilus influenza type B. Option B, parainfluenza viruses. Option C, respiratory syncytial virus. Option D, Streptococcus pyogenes. But Streptococcus pyogenes, where we have studied, already we have studied the Streptococcus pyogen in the case of the epiglottitis. Okay, in the case of the epiglottitis, right? So in the vaccinated child, unvaccinated child, Haemophilus influenza type B. In the vaccinated child, the Streptococcus pyogenes. If this one is not there in the option, Streptococcus pneumoniae. Okay, that was the very clear sentence I have told you all. Okay, yes, in the Haemophilus influenza type B, where we have studied, this one is the most common cause. Yes, in the unvaccinated child. Unvaccinated child, in case of again epiglottitis. Right? So where we have studied the parainfluenza virus as the most common cause. Better just now we have studied the parainfluenza virus as the most common cause. Where? Yes, in case of the Croup, we have studied the parainfluenza virus as the most common cause, and the most common cause for the bronchiolitis is, your answer goes to the respiratory syncytial virus. This is your golden question. It may strike directly in your exam. Do remember this one, because it is the very important, right? So hope you people have got understood about the particular causative organism. Yes, the respiratory syncytial virus is the most common cause of the bronchiolitis. Okay, here not the bronchi are inflaming. Here the bronchioles means the next portion of the bronchioles, next portion of the bronchi. Okay, so there is are getting inflammation, and there will be a highest chance of the mucus accumulation, and there is a highest chance of the airway, like a branched airway obstruction will be there. Okay, so I think every one of you know that what is the bronchiolitis. So this is the trachea, right? This one is the trachea, right? This trachea is divided into the right bronchi, and this one is the left bronchi, right? So this one divided into the right and left bronchi, right? So these bronchi are divided into the bronchioles. Okay, so here it is in the infection and inflammation of the bronchiole. So that is what we call it in the bronchiolitis. Okay, that is what we call it in the bronchiolitis, and these are the narrowed part. Okay, so here you will get the primary bronchi, secondary bronchi, and then you will get the bronchioles. Okay, then you will get the bronchioles. Okay, so whenever there is in the obstruction and the inflammation, so there will be a narrowed portion, airway obstruction will be there in the very important bronchioles. Okay, so that is what we call the bronchiolitis. Okay, so in the bronchiolitis, the bronchioles are inflammation will be there, and the most common age group of the happening of the bronchioles will be, that is the less than 6 months. Okay, so it will be in the case of the less than 6 months. The most common cause of the bronchiolitis is the most common causative organism of the bronchiolitis is the respiratory syncytial virus, and this respiratory syncytial virus is the having the highest risk happening in the immunocompromised children. Okay, so in the immunocompromised children, the risk of the bronchiolitis will be increased. Okay, in the immunocompromised children, the risk of the bronchiolitis will be increased. Do remember. Okay, so which position we have to give in the case of the bronchiolitis, sir? Sir, we have to give the position of the 30 to 40 degree elevated with the neck slightly extended. Sir, how we have to give the very important positions in the bronchiolitis? Yes, positions in the bronchiolitis is the 30 to 40 degree elevated and the neck will be slightly extended. Is that clear? Yes, is that clear to every one of you? Yes, beta, is that clear? Very important questions. Well done. So fatafat do thumbs up in the comment box. Yes, so the next golden point chanting, I told this respiratory syncytial virus is in the highest risk in the immunocompromised children, and this respiratory syncytial virus will spreads by the droplet route. Okay, so that is the reason these particular RSV children we can't admit with the other normal children which we have admitted in the hospital. Okay, so consider now a child will come with a nephrotic syndrome and we have started the steroid, and for that child we have admitted in the bed number 2, and this particular RSV child have came. Okay, we have admitted this particular child in the bed number 3. So already a nearby child which is having the nephrotic syndrome and already he is having the steroid. Okay, means already his state will be immunocompromised. So we are admitting this particular RSV child near to that particular nephrotic syndrome child, means there is easily transmission will happen. So that is the reason whenever the case with case of the bronchiolitis comes with the respiratory syncytial virus infection, so that time always isolate the child and keep the separate room. Okay, and standard precautions should be followed, and the transmission based precautions, that is the surgical mask will be must here. Okay, surgical mask is must here, beta, and along with that the strict hand hygiene we need to educate to the parents and the child also, because there is a child already in a state of the immunocompromised state. In order to prevent the infections and other secondary infections, strict hand hygiene is must here. Okay, so note the very important point here. So the nursing officer who is taking care of the a child with respiratory syncytial virus, she should not take care of the other children. Okay, so that is a separate nursing officer should be appointed to take care of this particular respiratory syncytial virus infected child, because it will transmit from one child to the another child very easily. Okay, so the nurse is caring for a child with respiratory syncytial virus, so she should not take care of the child, okay, with other disease conditions. Hope it is clear to every one of you. Yes, so we have to provide again here the cool humidified oxygen, beta, in a epiglottitis helioxide told the helium plus oxygen. Okay, and in the group also we have discussed the highly humidified oxygen, that is the cool mist oxygen. Okay, very important. And again in the case of the bronchiolitis we have to give the cool mist oxygen. Okay, that is the very important, right? And should not give the any honey containing cough syrups, and any cough syrups also you should not give here, because it will make the thickening of the mucus. Okay, so that is the very dangerous, right? So should not give the honey containing syrup. Why? Because this honey containing syrups in the children, it will increase the risk of the botulism. Okay, the risk of the botulism will be increased if we are administering the syrup or the cough syrup which is having the honey here. Okay, so nowadays children are the very bad children. Okay, why? Because they want continuous mobile, and in the syrup and in the tablet they want the sweetness. Yes, how it is possible the medications will get sweet? For that the medication companies, they are started to add some honey. Okay, some vaporizers, sorry, some what we can say like the tasting agents. Okay, so those agents which are acting as interfering with the medication, the life of the medication is decreasing. Okay, so and some few pharmaceutical companies. Okay, so in order to avoid the like bad taste of the syrup, they are adding the honey. Okay, so if you are giving the honey containing syrups, okay, so it will increase the risk of the botulism. Okay, in the case of the any respiratory disorder, so don't try to give the honey containing syrups, because it will increase the risk of the botulism in the children. Okay, so very important, right? So this is the standard and very important thing you have to understand. And one more very important thing, that is the ribavirin nebulization in the respiratory syncytial virus. Very important. Already asked a question in your Norcet. Norcet, the ribavirin nebulization. Beta, this ribavirin nebulization we are using to treat the a case of the bronchiolitis in the respiratory syncytial virus infection, and only we are using this one in a child who is completely immunocompromised and the child which is having the no response to the initial treatment. Okay, so then only we will use the ribavirin vaccine because it is very costly. So it is not vaccine, it is on the nebulization. Okay, so ribavirin nebulization is the very costly drug and it will not have that kind of the proven effect. So in the because of that particular reason, so we will use this one as a last option. Okay, so ribavirin in the respiratory syncytial virus used in the immunocompromised child with respiratory syncytial virus and not routinely used. Okay, it is not routinely used in all the children. Okay, all the children which are coming and admitting as the respiratory syncytial virus, in that particular all the children we will not use the ribavirin immunization. This ribavirin nebulization, not immunization. Okay, so we are not routinely using this ribavirin in the all the children. Okay, only we are using in the children with the immunocompromised state. I hope it is clear. Okay, so the route of administration of the ribavirin is the, I told it will be given by the nebulization. So how we will give the nebulization? Nebulization will be given by the inhalational route. Okay, so very important. All the important golden points we have cleared on the bronchiolitis. Okay, so yes, let me golden points revision again one more time. The bronchiolitis is the infection inflammation of the bronchioles. The most common age group is less than 6 months. The most common cause to organ is the respiratory syncytial virus. Position to be given as the 30 to 40 degree elevated with the head of the neck slightly extended. Okay, and the respiratory syncytial virus, it will spread by the droplet and isolation will be given to the children. Standard precautions will be measured. Standard precaution measures should be followed, and along with that strict hand hygiene should be followed because the child is already immunocompromised and there is highest risk of the infection. And the nurse who is taking care of the respiratory syncytial virus infected child should not take up care of the other children. Okay, and always we have to try to provide the cool humidified oxygen and should not give the honey containing cough syrups because it will cause the risk of the botulism. And the ribavirin inhalation or the ribavirin nebulization should be given only for the immunocompromised child and it is not routinely encouraged. Okay, so it is a very high cost drug and that is the reason we will routinely not give to all the children with a very important infection called as the bronchiolitis with the respiratory syncytial virus. The golden points are revised and are important, right? So the next comes to the very important question for every one of you. Here, beta, I will explain the IMNCI criteria of the pneumonia and I will explain a pneumonia in the children's. Typically, like classically, we will study two types of the pneumonia: typical, atypical pneumonia, and in the IMNCI classification, we will study a classification of the pneumonia like no pneumonia, pneumonia, severe pneumonia, and very severe pneumonia. Yes, the very important one. Multiple time asked questions in the lots of the tutor exams. Okay, and in the lots of the associate professors exams in the nursing colleges. Okay, so many time repeated questions. So these questions of the IMNCI classification of the pneumonia may strike in the Norcet also this time. So I will explain in detail, in perfect, with a very clear and very easy manner, so you people can enjoy the particular thing. Okay, so yes, so please do mention the correct answer for this question which I am showing on the screen to every one of you. Okay, so fatapat, do mention your answer in the comment box. Who are still didn't like to the session, so please do like to the session so I may increase my energy and I may come with a very valid and a very high yield questions, concept and the golden point chanting in the next session also. And do share the class with your friends and who are having the WhatsApp groups and the like your college groups. Okay, and some like college lectures if you are watching the classes. So please do share the video with your students because it is in the knowledge improving video. Okay, so you people will share the reels in the Instagram and you people will hesitate to share the classes like which increasing the knowledge which is in the free of cost, right? So fatapat do share the session also with your students. If you some tutors in the any nursing colleges are watching the classes. Okay, and please post the class with your WhatsApp status. So like I will get motivated because the more viewers, more students are coming means it will increase my energy to work on your success. right? Yes, very nice of you all. Few of you have given the correct answer for the particular question here. So what is the question? So which of the following is the most common cause of the atypical pneumonia? Okay, sir, what is the atypical pneumonia? What is the typical pneumonia? Already I have explained in the previous classes. Once again, I will do the golden point revision on this particular class, particular concept, because it is the important one. Okay, so yes, sir, the question is very simple. They have asked the question, which of the following is the most common cause for the atypical pneumonia? Okay, especially in the young adults, right? So what is the answer here? Option A, Streptococcus pneumoniae. Option B, Klebsiella pneumoniae. Option C, Mycoplasma pneumoniae. And option D, that is the Haemophilus influenza. So which one is the correct answer? Sir, what is the atypical pneumonia? Please teach us, sir. Yes, I will teach you. Beta, if you are having a atypical pneumonia, means it will not present all the classical symptoms of the pneumonia. Okay, in the typical pneumonia, what happens? In the typical pneumonia, okay, so whenever you will auscultate the lung, that time you will get the, yes, a crackle sound, right? And whenever you will see the lungs in the X-ray, it is the consolidated lung, means lungs parenchyma have been inflammation and there will be an accumulation of the fluid, pus, and the pus cells, okay, will be get accumulated. So that is what you call the consolidated lung. And whenever you will check the febrile status, so the child will be completely febrile, means the completely with fever, with chills will comes. Child will manifest with the fever with chills. Better now I am discussing the pneumonia in the children's, okay, and in the young adults, not in the case of the adults. So in the adults pneumonia, I will again come with the topic of the pneumonia. Here I will discuss. So what is the like community acquired pneumonia? Which one is the ventilator associated pneumonia? Which one is the like hospital acquired pneumonia? Everything I will discuss with the golden point. Don't worry. So now focus on this childhood pneumonia, because the question in the Norcet will ask from here only. Okay, so that is the very important thing, right? So wherever a child will comes with the typical pneumonia, it will be comes with a crackle sound. Okay, X-ray, consolidated lung, febrile with chills will be there. Okay, so along with that, all the classical symptoms of the pneumonia will be there. Okay, but in a case of the atypical pneumonia, we will not get the crackle sound. We will get the fine. Okay, so minimal lung sound we will get. Okay, and the X-ray will not be consolidated. It will not show consolidated X-ray. Okay, and the fever may comes. Okay, low grade fever may comes, but there is no any chills. Okay, so there is no any classical manifestation of the pneumonia. We call that one as the atypical pneumonia. Okay, so most common causative organism of the atypical pneumonia is the Mycoplasma pneumoniae. Okay, so the most common cause of the pneumonia is the Streptococcus pneumoniae, but the most common cause of the atypical pneumonia is the Mycoplasma pneumoniae. Okay, so do remember, very important, right? So let me golden point revision on the pneumonia. So in the children's, right? So what is the pneumonia? You know, there is an acute infection of the lung parenchyma, which including the alveoli and the surrounding tissue of the lung. Okay, so lung parenchyma, lung tissue or the alveoli is getting the inflammation, and where there is the accumulation of the pus fluid, which will causes the consolidation of the lungs. Okay, very important thing, just try to remember here. Okay, so what is the pneumonia? Pneumonia is the infection, inflammation of the lung parenchyma or the lung tissue. So that is the very important thing. Okay, so which leads to the inflammation and there is the consolidation of the lungs. So that is what you call as the pneumonia. Okay, so there are the two types of the pneumonia in the children's. One is the typical pneumonia, another is the atypical pneumonia. Okay, so in the typical pneumonia, okay, this is what we call the classical pneumonia, means all the classical symptoms will be appeared in the typical pneumonia. Here in the atypical pneumonia will happen, but there will be no manifestation of the classical sign symptoms of the pneumonia. Okay, for example, so pneumonia should be always in the children, it will come as acute pneumonia. There is a sudden onset will be there in the typical, but in the atypical pneumonia it will comes gradually. Okay, so that is the atypical pneumonia is gradual, typical pneumonia is the sudden. And whenever the child will cough, so I told in the typical pneumonia or in the classical pneumonia, there will be a consolidation of the lungs. Okay, so lungs will be filled with the fluid, pus, everything. Whenever the child will cough, that time the cough will come with a like a sputum. So that is what you call as the productive cough or the wet cough. The child is coughing and the sputum is coming. So that is the productive cough. What you call that one is the productive cough. Okay, child is coughing, there is no any sputum is coming. So that one what we call is the non-productive cough or the dry cough. Okay, so very important. In the typical pneumonia due to the consolidated lungs and the accumulation of the pus. So the sputum will come as a productive. Okay, so the cough will be manifested as the productive, and in the atypical pneumonia there is no any consolidation, but there is in the little infiltration will be there. So that will there will be a dry cough will be there. Okay, so remember, and the fever. And the fever I told here, the high grade fever will comes with the chill, and here will be a low grade fever, but there is no any chills. So right. So the organism, the most common cause to organism, that is the bacterial Streptococcus pneumoniae is the most common organism for the typical pneumonia. For the atypical pneumonia, the most common organism is the mycoplasma. The very important, right? So in the chest X-ray, there will be a lobar consolidation will be there. Okay, and in the atypical pneumonia only there is in the patchy and the interstitial infiltration will be there. Okay, so there is no any lobar consolidation classically we will see in the atypical pneumonia. Okay, so very important, the antibiotic response it will be easily responsive to the penicillins group, so that is the amoxicillin we can give. Okay, but here in the atypical pneumonia macrolides we need to start like azithromycin. Okay, so very important, we have to keep in your mind, right? So atypical pneumonia means it will not manifest with all the clinical classical symptoms, but a typical pneumonia which will manifest with all the clinical classical symptoms. Okay, so do remember the most common cause to organism for typical pneumonia is the lobar pneumonia and the bacteria, that is the Streptococcus pneumoniae, and the most common cause to organism for the atypical pneumonia is the our mycoplasm. Okay, and remember the one more golden word on the mycoplasm. Mycoplasm is the bacteria, it is not having the complete cell wall. Okay, so like the bacteria with a less cell wall. Okay, so that is the mycoplasm bacteria. Okay, so very important, do remember for your upcoming exam, right? So here are the assignment questions. Yes, the most common cause of the typical pneumonia, these assignment questions, okay, you have to mention in your comment box at the end of the video. Okay, most common cause of the typical pneumonia is the, yes, which one, and the most common cause of the atypical pneumonia is the which one. Okay, so just you have to mention in the comment box. Then here comes to the golden content for your exams. Okay, very important, full 5-star questions. Okay, full 5-star concept, not half 5-star, it is in the full 5-star concept, because it have been struck in your exam multiple times, right? So please do remember whatever the basic concept I am explaining, try to understand the basic concept, then after that I will explain danger signs, then after that I will explain what is the IMNCI classification of the pneumonia. Okay, so everything, because it is a very important concept and I am teaching only to you people. Okay, so please do remember this one, right? So yes, just for comedy purpose, yes, let's come to the concept discussion on the IMNCI classification of the pneumonia. The first word comes to every one of you. What is the full form of the IMNCI? Yes, that is the integrated management of the neonatal and the childhood illnesses we are managing. How we are managing? We are integratedly managing by integrating with our health system. So which including the home management, which including the close observation at the PHC, CHC level, and which including the referral services till the highest healthcare facility. Okay, so that is the integratedly we are managing both the neonatal and the childhood illnesses. First question is clear. The second question, the age group which we have been covering in the IMNCI is the child with age of the 2 months to the 5 years we are covering here, right? So here when we will come the IMNCI classification of the pneumonia, so here in the every classification you will get the fast breathing, no fast breathing, okay, danger sign, no danger sign like word. So first you have to understand what is fast breathing and what is the IMNCI criteria how to say the fast breathing in the pneumonia. Okay, so remember the fast breathing criteria. Okay, here if the child is 2 months to the 1 year of the age, if the child respiratory rate is more than 50 breaths per minute, so we call this one as in the fast breathing child. If it is 49, no fast breathing, 43, no fast breathing, 40, no fast breathing. Like if it is less than 50 in the 2 months to the 1 year, no fast breathing. Which is more than 50 in the 2 months to the 1 year, which is called as the fast breathing, right? 55 breaths per minute in a 8-month children. Is that fast breathing or the no fast breathing? Fatafat do mention in the comment box. A 8-month child is there and which is having the 55 breaths per minute. Yes, is that fast breathing or the no fast breathing? Well done, beta. It is on the FB. Okay, that is not Facebook. That is the fast breathing, right? So the 2 months to the 1 year, which is having the more than 50 breaths per minute, we call that one as the fast breathing, right? So similarly, 1 year to the 5 year child, okay, which is having the breathing rate is, or the respiratory rate is more than 40 breaths per minute. So we call that one as the fast breathing in a child of the age group of the 1 year to the 5 year. Is that clear to every one of you? Yes, it's clear, right? So we have got clarity about the fast breathing. Then what about the general danger signs we have to see in a very severe pneumonia? Okay, so we will study the 4 classification. No pneumonia first, second one is the pneumonia, third one is the severe pneumonia, fourth one is the very severe pneumonia. And this general danger sign will be only seen in the very severe pneumonia. It will not be seen in the severe pneumonia. It will not be seen in the pneumonia. It will not be seen in the no pneumonia. Remember the golden point. General danger signs are only seen in case of very severe pneumonia. Is that clear? Clear. Yes. Sir, what are the generalized danger signs in the pneumonia, sir? Yes, the child, due to the pneumonia condition, child is unable to drink, unable to feed, and whatever the feeding it entered the stomach, it is the child is vomiting everything, and the convulsion is there, and a very important lethargy and unconsciousness is there, and the stridor is there when the child is cool, calm, relaxed. In that particular situation, okay, when the child is in the calm, then also the stridor is there, right? And the child is level of consciousness is altering, that the unconsciousness or the lethargy is there. So in this particular situation also we call this all are the or as a danger sign. Okay, sir, how to remember this one, sir? Yes, we love. Okay, so you can remember this one as in the a mnemonic that is called as the LIC. Okay, so you can remember as in the LIC VS. Okay, so V is the, yes, that is in the vomiting of the thing whatever it is having. Okay, and the stridor in the our cool, calm, relaxed time also. Okay, so L is the lethargic and the unconsciousness. I is the, there is the inability to feed and drink, and C is the convulsion. Okay, so LIC VS. Okay, so remember the LIC VS, these all are called as on the generalized danger signs in the pneumonia. If generalized danger signs are there, means we call this one as in the very severe pneumonia. Very important. Keep in your mind. Okay, sir. Then comes to the classification of the pneumonia according to the color coding. Beta, sir, we have the 3 color codes in the IMNCA classification. So which including the everything, which including the dehydration, which including the management of the like severe acute malnutrition, and which including the management of the pneumonia, whatever it may be. All the categories in the IMNCA we have considered in the 3 categories, that is in the pig category. Okay, so what is the spelling of the fig, sir? PIG pig we have studied. Now we have to study PYG fig. Okay, so what is the PYG pig here? Pink color, yellow color, green color. Okay, so not PIG pig, that one is your childhood spelling. So forget the PIG pig and remember the new like new spelling of the pig, that is the PYG pig. Okay, so here the P stands here as the pink color, Y stands here as the yellow color, G stands here as the green color, and red color is not part. Okay, red is not part of IMNCA. Red is not a part of IMNCI. So this one is your exam question. Yes, sir, what are the color codings we have in the IMNCA? So you have to remember with the pig, and also you have to remember the word, that is the red is not a part of the our IMNCA, because in the option you will get red as an option. Okay, so don't forget, red is not a part of the IMNCA color coding. Okay, so in the color coding we have the green, yellow, pink. Yes, remember what all are we have here is the, that is the PYG fig. Pink, yellow, green. Green is for the home remedies, Y is for the observation and the sending to the home, and pink is for the urgent referrals to the higher authority. Okay, so remember in the IMNCA, so if the child is having the no pneumonia, so when we will say child will have the no pneumonia, so these symptoms are present means we will say the child will have no pneumonia. There is no fast breathing, there is no chest indrawing, there is no any danger sign. Okay, so there is no any LICVS. Okay, so lethargy is not there, convulsion is not there. Okay, and the inability to feeding and drinking is not there. Okay, so the child is completely normal. There is no any danger sign, and there is no any chest retraction, chest indrawing is also absent, and the child is not having the fast breathing. Okay, so child is having the normal breathing. Only and only child is having the cough and cold. Okay, so only and only child is having the cough and cold means we call this one is in the no pneumonia. Okay, so this is what we call as the no pneumonia. So in the no pneumonia we will classify this one into a green category. Okay, so no pneumonia will be classified in the green category, and we will not advise any antibiotic care, just we will advise the home remedies. Okay, so we will advise for the taking the, like what we can say, inhale the some hot airs. Okay, so like we can advise to the mother and to maintain the immunity, and we will explain the danger signs, and we will send her to the home back. Okay, so if the child is having the pneumonia, okay, so that we will classify the child in the yellow category. Okay, sir, when we will say the child will have the pneumonia, okay, so if the child is having the cough and the cold and the difficulty in the breathing, and the child is having the fast breathing, okay, but no chest indrawing, no danger sign, cough and cold plus fast breathing, that is the pneumonia. Only cough and cold, no fast breathing, no chest indrawing, no danger sign, that is the our yes, no pneumonia. No pneumonia means no fast breathing, no chest indrawing, no danger sign, only cough and cold, that is the no pneumonia. In the pneumonia, fast breathing is there, cough and cold is there, but no chest indrawing, no danger sign, that is the pneumonia. Okay, so this particular case we will categorize under the pink category, and we will give the oral antibiotic. Okay, that is the oral amoxicillin we will give here for the duration of the 5 days. Okay, so after 5 days we will call for the again for the follow-up. Okay, so this will be a close monitoring and the OPD basis treatment, and we will again we will advise the mother to watch for the danger signs. Okay, so that is the very important thing we will do in the yellow category. Okay, so then comes to the severe pneumonia and very severe pneumonia. Okay, so both severe pneumonia and very severe pneumonia, so these both are classified under the pink category. Here we will start the IV antibiotic immediately, so that one amoxicillin plus gentamicin we will give here. Okay, sorry, ampicillin plus gentamicin we will give here. Okay, so first, after giving the first dose of the antibiotic, we will refer the child urgently to the higher health facilities, because in case of the severe and very severe pneumonia, there is highest chance of the sudden desaturation of the child. Okay, the saturation of the child may come less than 60, less than 50. Okay, so the oxygen demand keeps on increasing, and the oxygen exchange is not happening due to the consolidated lung. Okay, so in that particular situation, we need the support of the intubation and ventilator. We will send the child to the higher authority in case of the severe pneumonia and very severe pneumonia. Okay, so sir, when we will say the pneumonia is a severe pneumonia, yes, along with the cough, cold, okay, the chest indrawing also present, fast breathing also present, but there is no general danger sign. Okay, but I told while explaining the generalized danger sign, so that is seen only in a case of the very severe pneumonia. Okay, so in the very severe pneumonia, what happens? All the symptoms of the severe pneumonia will comes. Okay, like fast breathing will be there, chest indrawing will be there, and cough will be there, cold will be there. Okay, along with that, the danger signs are also present. So this is called as the very severe pneumonia. Okay, so like already I have discussed, any danger signs such as the inability to drink or feed, vomiting, convulsion, lethargy, stridor in the calm situation. Okay, so these are the danger signs of the pneumonia. Okay, so hope every one of you have enjoyed the particular session. Now come to the question discussion. Okay, so this is the summary what you have to write in your notebooks. Okay, so this is the last minute revision. Again, just only revise this particular table for your exam, that is more than enough. Okay, so this is the very important summary. Right, sir, I told in the no pneumonia, no fast breathing, no chest indrawing, nothing will be there, only cough and cold will be there. Home care support we are giving. Okay, no antibiotic required. In the pneumonia, okay, cough, cold plus fast breathing will be there, but no chest retraction, no any like danger sign. So that is what we call the pneumonia. Here oral antibiotic we are giving at the home. So that is which one we are giving? That is the amoxicillin for 5 days, right? In a pneumonia case. In a severe pneumonia, yes, the chest indrawing will be there. Along with the chest indrawing, fast breathing will be there. Yes, but there is no danger signs. That is, we will give the first dose of the antibiotic and we will refer the patient to the higher higher hospitals. Okay, so next if the danger sign is present, that is the only very severe pneumonia. In the very severe pneumonia only the danger sign is present. Okay, in the other pneumonia there is no danger signs. Urgent referral we will do oxygens plus injectable antibiotics. So I told the two very important drugs here in the very severe pneumonia, that is our ampicillin plus gentamicin we will give, and after that we will refer to the hospitals immediately. Okay, so with the oxygen support. Hope this particular summary will help you, every one of you. And here is the next question. Try to give the best response, because the entire concept we have discussed just now in front of you people only. Yes, what is the respiratory rate threshold for the fast breathing in a child of the age group of the 12 months to 2 months to 12 months, means 2 months to 1 year? What is the criteria of the fast breathing? Beta, according to the IMNCA, I told if the child is belongs to the 2 months to 1 year, if the child is having the more than 50 breaths per minute, we call this one as in the Facebook. We call this one as in the fast breathing, not Facebook. Okay, right? FB is not Facebook. FB is your fast breathing. If the child is belongs to the age group of the 1 year to the 5 year. Okay, in this particular situation, if the child is having the breathing rate of more than 40 breaths per minute, we call this one as in the fast breathing. Okay, we call this one as in the fast breathing. Okay, so in the question what they have asked, 2 months to 12 means according to the IMNC. Okay, so more than 50 or equal to 50 breaths per minute, we call this one as the fast breathing. Okay, more than 40 is for the 1 year to the 5 year children. Okay, so this was your very important question for your upcoming exam. Okay, so I hope it is clear to everybody of you, right? What is the respiratory rate threshold for the fast breathing in the children of the age group of the 2 to 12 months according to IMNC? Hope the answer is clear to every one of you. So far, do thumbs up in the comment box. Yes. And here's the question. Okay, whatever the things you have learned in the IMNC, so please apply that particular knowledge in this particular question and answer will be yours. Just try to classify the which type of the pneumonia is this. Now the child is having the 4 year age group. Okay, in the IMNC, so till what age groups we are studying? 5 months, 2 months to the 5 years. Okay, so this is the age group criteria of the IMNC guidelines. Okay, so now a child is 4 years, means which is belongs to the this particular criteria only. Okay, and now the child is present with the cough is there and respiratory rate is 44 is there. Okay, and there is no any chest indrawing, no chest indrawing. Okay, and the danger signs are there is no chest indrawing or there is no danger signs. Okay, no chest indrawing and danger signs. So what is the IMNC classification of this particular child here? Yes, beta, cough is there, but fast breathing is there. Yes, in the 4 year means if the respiratory rate more than 40, so that is what we call as the fast breathing, right? So here he is having the 44 breaths per minute. So the answer is, what is the answer? I want everybody's classification of this particular pneumonia, okay, in the answer. Okay, so the criteria I will tell. Okay, you people should mention in the comment box, right? So here there is in the cough is there, cough present. Okay, along with that age group of the 4 years means 44 breaths per minute. Okay, after 1 year till the 5 year, if the respiratory rate which is going more than 40, we call that as the fast breathing. Here the respiratory rate is 44, means the fast breathing is present. Okay, fast breathing is present. right? So there is no chest in drawing, no danger sign. No chest in drawing, no danger sign. So which type of pneumonia is this? I want everybody's answer in the comment box. Okay. So yes, almost all you people have given. This is the a case of the just case of the pneumonia. Okay. So it is not a sorry. Yes, it is a just case of the pneumonia, right? Here comes pneumonia. Okay. So fast breathing is there. Okay. Cough is there, but no chest indrawing, no danger sign. Yes, in the severe pneumonia, we have the chest indrawing, but in the question, there they have not mentioned there is no any chest indrawing. So answer goes to the pneumonia. Okay, so hope everybody have clarity about this particular questions concept what I have explained to every one of you on this particular today's session, and whatever the golden point revision we have done on the pneumonia in the children's. Okay, so this is the very important thing, and whatever the golden point revision we have done on the fast breathing criteria, danger sign criteria, okay, typical or typical pneumonia. Okay, so along with that we have discussed lots of the things related to bronchiolitis. Okay, and along with we have discussed the very important things and questions on the other disorders also. Okay, so here are your assignment questions. Okay, so assignment questions are here, so please do mention the assignment questions at the end of the video. The question number 1, the most common cause of the typical pneumonia. The question number 2, the most common cause of the atypical pneumonia. So just try to mention the answer in the comment box. Okay, so hope you people have been enjoyed the today's session, and if you are any one of you are searching for the good quality test series for your upcoming Norcet practice, so please do download the master nursing classes, and which plan suits to you, so you can choose that one. Okay, you can practice that one, because we are giving the high quality and updated and the important questions concept that is much necessary for your practice for your upcoming exam. Hope every one of you enjoyed the today's session. Thank you so much for watching the video. Don't forget to share the session with your friends if possible. Okay, so please keep the class with your WhatsApp status. It will help other students who wants to study free of cost. Okay, they can utilize this one. Okay, so thank you so much for watching the video. Jai Hind, Jai Bharat. We will meet again with the high quality content in the next session. So here in the short period, the heavy content and the huge content and only important content I am covering for your exams. So thank you so much for watching the video till then. We will meet again in the next video. Jai Hind, Jai Bharat. Okay, so don't forget to join our WhatsApp channel, and don't forget to download the master nursing classes app. Okay, the link are given in the description box. Bye bye. Take care. Love you all.